I'm a student nurse, so today we're going to be sectioning your trach. The reason is that we noticed your SpO2 is a little low and there was secretions heard in your trach's airway, so we're going to continuously monitor your SpO2 levels by having a pulse ox kept on you the whole time we're doing this. So before we get anything started, I'm going to get you sat up, have them sitting you up. Can you please tell me your first, last name, and date of birth? Blah, blah, blah. They tell me. Okay, dope. Are you able to cough at all for me?
Wait, check if it's fenestrated first if they can tell you. Yeah.
About that. Thank you. Okay, so I'm going to bring you up. I'm going to ask you a couple questions. First, let me check your trach. Okay, it's fenestrated, so I know the patient can talk. I'm going to ask them to give me their first and last name and date of birth. They're going to give that to me. I'm going to say, okay, great. Are you able to cough at all for me? They're going to say yes or no. The patient's going to say no. It's too hard for them. I said, okay, not a problem. So I'm going to get all my equipment set up. So when I'm doing so, I'm going to have you do diaphragmatic breathing for me. You're just going to take really big, deep breaths as much as you can, almost into your belly, and continuously do that while I'm setting up my equipment, okay? So first, I'm going to loosen the mask on one side, because I'm taking that off. I'm going to put this towel down, and then once I put the towel down, I'm going to don eyewear, mask, gloves, gown.
No gloves.
Oh,
Just
yeah.
three, yeah.
And I'm going to wash my hands. I'm going to set up my yonker. I'm going to loosen it. Too much loosening. Okay, the yonker is loosened. I am going to have my portable section on to 10 to 15. Perfect. So now I am going to check my sterile saline. I'm going to make sure my expiration date is good. It is good. Perfect. So I'm going to pop that. I'm going to open my suction catheter kit and sterile technique. And then I am going to put this down because I don't want to cheat. I'm going to open my gloves. Note that my gear is on, my goggles, my face mask, and my gown are already on. These are my sterile gloves that I will be putting on. I'm going to slip my gloves on. To maintain sterile technique the entire time. I probably flicked that away too early, but it's okay.
It's okay.
Okay, I'm gonna pull my fingers down all the way, make sure everything's taut. Tight, taut. Okay, wonderful. So now I am going to I'm going to take that off. I don't like what Nate said.
Yeah, I know, me too.
It doesn't make sense to touch something after.
Yeah.
So I'm going to leave it open. Okay, so we'll say that it's already open. I'm going to toss these gloves aside. I'm going to pull out my catheter section with two hands, making sure to maintain control of it. That way it doesn't flip anywhere, and I am able to control it. So now this will be my hand that I'm using to use the catheter, and then this one will be my dirty hand. So what I'm going to do is pop off my yonker. I'm going to pull this tight, making sure not to contaminate it. We have suction. Okay. I'm going to lubricate this with sterile saline. Okay. The patient is continuously breathing. I am going to remove the oxygen mask. I'm going to hold a tight position, like an arrow, making sure not to contaminate anything or touch anything else. I'm going to insert that to the 20 line without suction, and then I'm going to roll out for 10 to 12 seconds. Okay, it's out. I'm immediately going to put my oxygen back on my patient. They're going to re-oxygenate for 2 minutes. I'm going to continuously monitor my SpO2. Probably won't show till 5 minutes afterwards, but I'm still going to continuously monitor, make sure it's not going down any more than it is. I'm going to remove the suction once again. Leave the oxygen on. I'm going to get saline, and then I'm going to now remove the oxygen once again. This will be my 3rd time doing it. Let's say I'm going to do it for a minimum of 3 times, making sure I don't contaminate anything. Hold this tight and insert.
It's okay, it didn't happen.
Hold this tight and insert. Okay, without suction, and then I'm going to roll for 10 to 12 seconds, no more than 12 while suctioning. I'm immediately going to put my oxygen back on my patient. I'm going to get saline once again. I'm going to flush that line. I also note that my patient needs additional suctioning in the naso and oropharynx, so I am going to insert this no more than 6 inches into the nasopharynx. Initially not suctioning, insert 6 inches. I can completely suction while pulling out. Okay, let that go once again. I'm going to flush it once again with saline. I don't think they want all that stuff in their nose. I'm going to insert once again, no more than 6 inches. Okay, and then I'm going to apply continuous suction. Perfect. Saline. Now I'm going to suction the oropharynx and get all around the gums, teeth, under the tongue, making sure not to hit the uvula to engage the gag reflex. You're good, Gucci. Okay, awesome. So now I'm going to flush my tubing completely. Make sure everything comes out of my tubing. Make sure this is completely clean. And then I'm going to wrap this up in my hand. I'm going to turn off my suction. I'm going to attach my yonker back. I'm going to dispose of my supplies, like so, blah, blah, blah. And then I'm going to dispose of my supplies, and then I'm going to wash my hands now, and then I am going to document coca, color, consistency, odor, and what does the A stand for?
Amount.
And then the amount that was sectioned. I'm going to let my patient know that I used a 14 French for the catheter, and noting patient is breathing without difficulty.
So the only thing is that you have to remove the towel.
Oh,
Yeah, remove the towel, and you have to indicate that you're removing your gown and goggles and all that.
Got it.
Which you might have done. I don't know. I can't remember.
I just said remove equipment.
Yeah, okay.
But if not,
All right.